Patients suffering with an enlarged prostate now have a new treatment option. It's called Urolift. Our Quentin Smith is speaking with some local doctors in Columbus and has more on this new procedure.
So a lot of the treatments that have been previously done for enlarged prostates have involved cutting tissue in the prostate or removing the tissue using a laser.
But now a newly approved treatment called Urolift is changing that procedure at Columbus Urology.
It gives us another avenue or option to offer patients.
What it is basically about a 5-minute to 10-minute procedure in the operating room or in the office.
Urologist Joshua Griffin explains how Urolift works.
This procedure takes on a whole different concept. Instead of actually cutting or removing tissue, we actually push the prostate apart to open up the channel so that the patient can urinate better.
Griffin says they give patients anesthesia before the procedure begins. And this new technology also means patients won't have to worry about a hospital stay. Urologist Ben Woodson says most men are good candidates for this treatment.
They need to be thoroughly evaluated first and make sure they have a proper diagnosis of BPH or benign prostatic hypertrophy. Having said that, if that's the case, then most men are good candidates, barring their prostate's not of greater than 80 grams, which we would typically measure in the office.
And unlike older enlarged prostate treatments, Griffin says there are no sexual side effects from Urolift.
Has a lot of other advantages over the older treatments in that a lot of men have problems with sexual side effects, both from the medical treatment and the surgical treatment for enlarged prostate, and Urolift has been pretty clearly shown not to have any of these side effects.
In Columbus, Quentin Smith, WCBI News.
Quentin, thank you. Columbus Urology started using Urolift earlier this year. They've done about a dozen procedures over there.